My name is Star August Ali, also known as Sister Star. I'm the executive director and founder of a nonprofit based on the South Side of Chicago that focuses on Black mental health. I'm also a community-based provider, specifically a certified professional midwife. The birth of my first child, I'm a mom of four, just wasn't like the best experience. I kind of came out of that feeling really traumatized, and I started to live more and more into it. I was like, okay, like, yeah, there needs to be more Black midwives, more representation of people from my community. So yeah, I was like, I definitely want to be a midwife, but for the time being, I'm going to try to become a doula, just because I know the sacrifice it's going to take to become a midwife. When I first got to this state, I'm originally from California. It was actually illegal to practice here as a CPM. So I joined an organization by the name of ICC-CPM, which was predominantly all-white organization that was essentially the head or the chapter head for the national chapter for CPMs. Became the first president of color in a 40-year push for them trying to legalize home birth midwives that actually got it within 6 months of my presidency.
Why do I want to go to get the CPM certification? What did it look like? Okay, so I know that I wanted to work in community-based birth. I know that I did not want to work in an institutionalized setting at all, so there was no need for me to go to nursing school to get a nursing degree to do midwifery work. So my experience in terms of getting the CPM so you do have to pay for the credential. I did go to Southwest Tech. I think it was under $15,000, which isn't bad. But the location was the issue. It was, like I said, an all-white Amish community. I did full state driving there. Associate night or having a preception in that area was just a difficult thing. That was an issue. And then also like not being able to quote unquote have like a typical 9 to 5 because you have to have that flexibility in order to be available to go to birth. So if you don't have any ability, that people won't allow you to work in their practice as a student. And so it's like you have to really be very creative and think outside of the box. So a lot of us did doula work and that's the training for midwifery work, which I did. I also did like overnight postpartum care. The families knowing that, hey, I'm also a student midwife, so I may have to leave. But that was tricky in itself too. And then like also like things, so like having to spend so much time away from my children that I did in order to do this training. I think it's really hard. Race and identity have definitely played a role in my journey. It's not a coincidence that I went on to qualified CPMs in the state of Illinois. We have not been censored in this work. And I'm happy that there is starting to be a shift and people are starting to listen to what Black women have to say. One piece of advice I would give is to figure out in what capacity have you been called to serve in this work. And once you're there, completely submit yourself to it and know that every great thing will follow. Right.